What we're really talking about is a reset, right? There are a number of studies that are showing up right now relative to COVID-19 and this pandemic that is true that scientists are saying there's a reset on air because we're in our homes, communities that have smog and issues with the air is cleaner. There are a number of studies that are talking about there's a reset on water, that water is actually showing up cleaner. And I will tell you that people are talking about the fact that animals are thriving. I know it for a fact if I go in my backyard that I'm seeing animals and birds and all this other kind of stuff that I didn't see before. And even when I go out for my walks or my jog, there are several animals showing up. We have fox that are showing up in the area. I've never seen a fox in this area, not like that. And so there's a reset on water, air, and animals. My question is, what's the reset on our humanity? And are we willing to really take this moment in time to do a true reset, to see each other's humanity, and do something about any injustices that have been that people have felt, to really connect with each other in a way that is authentic, genuine, and truly for the betterment of all. I think that's the moment in time we're in. Are we really to step in and do the real reset and own everything that has brought us to this point? Thank you.
Hi, and welcome to another episode of Dawncast. I'm Di Lee. And today I've got a wonderful friend who I met through a few years ago in his work in diversity and inclusion, Bart Bailey. Bart is a consultant, a facilitator in the diversity, access and equity space, but who's got a keen interest on humanity and belonging. So welcome to Dawncast, Bart. How are you?
I'm well, Di. How are you?
Good, good. How have you managed during this COVID-19 lockdown period?
Yeah, there's been a lot going on, and it's interesting. It's always one of those things where someone says, "How are you? How are you?" And we do the pleasantries. Now, you kind of know me a little bit, so I tend to be more open, right?
Yeah.
And so the real answer is, I am in a healthy space and I'm well. I wouldn't say good, right? And so I have actually been, I sometimes say, the ripple effect of COVID. So I've been impacted by that.
Yes, I understand. I'm so sorry. I believe your father passed away as a result of COVID-19. Is that right?
Yeah. So May 4th, he was in a nursing home for elders. Had there was some concern around dementia and some things like that. He had been there for a couple of years and contracted it at some point in time. Went to the hospital Thursday and Friday kind of thing. Was intubated and tested positive for COVID. And once he got on the respirator, he did not come off. And so May 4th, which was a Monday, he passed.
Now, I don't get it in terms of people being in uh, nursing homes or places like your father. How do they catch COVID? Is that through the other elderly or ill patients, or is it through people working there, nurses and staff there, that brought COVID-19 in?
Yeah. So this particular facility, what we understand is the first person who tested positive was their activities director. And so this is support staff. And so the activities director, who is in and out, and their job is to meet with a bunch of people, tested positive. Now, once they knew, then they quarantined her. But at that point, that was probably 3 weeks prior to him passing. I do remember April 29th, there were 26 people that tested positive, and that's staff and residents. So I would say over a 3 to 4 week period from that first person, they went to 26 kind of quickly.
Wow. Within that same facility?
Yeah, yeah. And so you see that. And so he was in Rockville, Maryland, and that's an area that I don't know how to equate it, but it's like a suburb of Sydney, right? It's a it's a well-off area. I'll just say that. People are in and out, and so the folks that don't stay there are doing their normal thing. Now, this is before we got to the point of saying, make sure you wear your mask, make sure you do social distancing and all that. So I'm sure that person was just doing their normal routine, contracted it, and then went to work. And then it kind of spread kind of quickly.
How, I
Go
was going to
ahead.
say, how old was your father?
So my father had celebrated his 80th birthday on March 27th. And even then, there were some things going on. And so we could not actually go see him, but we were able to do something similar to this. We used Skype and was able to sing happy birthday to him. And he was smiling, and I should have recorded it, but I took a picture of it. And it was actually a really, really special thing. I ordered a cheesecake from some place that he likes in New York, and it was they delivered it, and so it was really good.
The Cheesecake Factory.
Well, so this place is a little better than Cheesecake Factory. It's a place called
So,
place called Juniors in Brooklyn.
but did he actually pass away as a result of COVID-19, or did he have other ailments that COVID-19 really just pushed him across the border or across the line?
Yeah, so he had pre-existing conditions, right? And so when you start to look at some of the studies and you start to look at just the percentage of people that end up passing, typically there's some other pre-existing conditions. So he had high blood pressure. And the whole thing where we realized that something wasn't right, he was actually supposed to be performing a dialysis, and they had some complications with that being done. And so between high blood pressure, dialysis, and his age at 80 years old, there were other mitigating factors. And so I say that, as we look at some of the data, there's something that was done April 11th in the New York Times that started to touch on some of the disparities and how it breaks out with race and people who are passing. So I'll share a few things with you.
Yeah,
right? And
that's interesting. I mean, the concept of disparity in this COVID-19, period. What does that mean?
Right. So just some data, and this is a while ago, and it's still the CDC put out some stuff recently, or NPR they put out some stuff recently. But back then, some of the data was the state of Louisiana, right? African Americans make up 32% of the population, yet 70% of COVID-19 deaths.
70 of
the deaths, right? And then Illinois, 15% of the population, 42% of the COVID-19 deaths. Michigan, 14% of the population for African Americans, but 40% of the COVID-19 deaths. And then Chicago, 30% of the population, 72% of the COVID-19 deaths. And so when you look at the data, right, you're like, well, how is that possible? Right. And so you get into disparities, and there's different layers to that. One is pre-existing conditions. And then you start saying, well, how do we get to pre-existing conditions? Some of it is lifestyle. Some of it is access to food. So, similar to when you took me to, what was it,
Cabramatta in
right.
Yes, Sydney Southwest.
Right. So think about that whole travel, right? And in certain areas, how close is a grocery store, right? And so for some of these communities, the grocery store isn't right around the corner. It's, you got to have a car to get there or whatever. But here where I'm at, where I live, there's 3 grocery stores within, I could walk to them, right? And I'm talking big, large grocery stores. But some communities, they have deserts. We call them food deserts rather. And so you have to travel a different distance to get healthy food. So it could be food, it could be education. So there are a number of things that contribute to those health conditions.
Right.
And some of those have been generational in the communities where we live, or So there's just a lot of stuff to it.
But the people that have been, according to those stats, a doubling of, a percentage and a double of the deaths in the African American community. But what is that related to? Is that the fact that they're living in close proximity on top of one another, or is it they're more older population in that community and therefore they're more susceptible to diseases and illnesses, and COVID was just kind of pushed them again across the line? What are some of the factors, rather than saying, okay, we've got 20% African American, but there are 40% of those have got COVID? What is that related to, though?
So there's a doctor. There's two doctors. They're twins, Blackstock, Uche and One, and they're here in the New York area. And Dr. Uche was talking about this, and she talks about social economic factors, right? And so it's job status, right? So if I'm a frontline worker and my job is about, I drive the buses that are in the area. I drive the transit trains in the area. So I'm in contact with a lot of people. And so it could be the job, it could be family, it could be the fact that I live in a place where I can't really isolate. So now once I test positive, everybody else is going to be, impacted by that. Support systems and income, right? In some communities, people left their area and they went someplace so that they could isolate. They're in green spaces. Some of the more cities and urban, there is a little bit more close living with each other, and similar like you have in Sydney as well. And then the physical environment, right? Just the physical environment itself contributes to that. Whether what I was talking about, whether green space or spaces where you have more grass and open area. And then health factors, diet, exercise, all of that kind of stuff shows up too. But I would say it's even in areas where I live, that's I don't know what you want to call it, but it's not in the city, right? The numbers are still disproportionate. And so it could be, there's some things around when we talk about implicit bias and all that in terms of healthcare, right? And so there's been a number of studies that doctors may underprescribe because there's a belief that this person has a higher pain tolerance, right? Based on their ethnicity and their background. Oh, they're okay. We don't need to prescribe this or that. And so those things show up too, right? How do you really see me and care for me as a human being versus, some of the other things that may be hindering our ability to really provide care?
Could it also be that perhaps, I don't know, but only a doctor or some scientist could explain, is that our physiological makeup could be that African Americans could be more susceptible to an illness or a virus like COVID-19. Do you think that could be the case, to explain the double in terms of in the numbers of people being affected by COVID-19 in the States?
No, I would say no, right? So that one right there, when you look from an anatomy standpoint in the physiology of our bodies, we're over 99% or 95% the same, right? It's all this other stuff that gets in the way. So that's not it. It's the pre-existing condition. So if I am, for whatever reason, I may fall into the area of diabetes, I may fall into the area of hypertension. Those typically are related to the food I eat and my health habits, right? And income. I may not have access to more healthier food. So I'm, whatever it is I do. And again, that's not across the board, but for some that shows up, right? There's studies out there. There's an awesome organization that it's called First Year Cleveland in Ohio. In one particular county, African-American women during given childbirth are 4 times as likely to die given childbirth as white women. Okay. Mm-hmm. And there's a number of stats that fall into that. And it's not about their body. It's about the care that's given, right? Prenatal care, all that kind of stuff. And so so they are going after those things head on. And so it's a healthcare, I would say, a group of people that are part of First Year Cleveland that are really trying to deal with those numbers. And years ago, they actually brought those numbers pretty close. by being in the community versus having people come out of the community where they don't feel trusted, they don't feel like they're being seen, right? Think about it. If you went someplace and you didn't feel like people saw you and your humanity, would you return?
Yeah, no, I mean, yeah,
and
and if but the healthcare system in the States it's also really challenging, isn't it? Because it's not free.
no, it's not free. And so there are a number of things around that. And so when I say that they got the numbers, that particular county got the numbers pretty
Close,
aligned,
yes.
they were giving some care in the communities for a large range of people, whether you had insurance or not. And they started, because the care was so good, they started having everybody start to come there. And so the institutions, the larger institutions, said, wait a minute, I don't know if we want that, because they were taking business from them, right?
Because you have to have insurance, is that right? You have to have insurance to have a good care and good access to health care in the United States. Is that correct?
I would say yes. Yeah. So your health insurance is going to help you. There's other stuff that you can get, and that care is good. It's just different, right? I because I've never been on any of that, and I do know some folks that have been, and their experiences have been great. But it is a different level of care.
So, do you have a healthcare insurance?
I do, yeah.
Right. Okay.
Yeah. Yeah.
So in terms of the people, I mean, the United States, I haven't got the figure in front of me, but have experienced a lot of deaths as a result of COVID-19. Are you saying that a large proportion, and do you have the numbers to share with us that the numbers of a large proportion of that are African American?
Yeah. So one of the things, and I was looking for that, I printed it. So I would say there are, if you go to NPR just recently put out some information about that. And
Right.
And so I think we're at 100,000 deaths right now in the United States. And they're trying to track this data, right? And so they're using census tracking, and they've partnered with another institution that's really looking at that. And so some of the things that they're talking about, out of 48 states plus the Washington, D.C., there's a report of some data, right, that talks about race and ethnicity. And so 90.
So here I've got an NPR one whereby the cases in the United States is about 1,700,000 and about 746, 1,746,000, and the death is about 102 so far.
Yes.
Yep.
Yep.
So that's
and then,
the. But
and
how?
then keep looking, because so that those are the people who have tested positive. The 102 are the number of deaths.
Deaths. Yep.
And then when you keep going into that study, it talks about ethnicity is known for nearly half of all cases and 90% of those deaths. And then it starts to really break it down into ethnicity, background, and race, and it's disproportionately based on the percentage of people in the population, is disproportionately high for African Americans. It's high for Hispanics and Latinos as well.
So is there a sense in the United States, out of this whole COVID-19, there's a sense of unfairness? I don't know if it's the right word, but the community, the African community that are seeing more deaths than, say, the rest of the population, are they feeling like they're being neglected, or that not enough is being done for the community?
So, yeah, I mean, at the end of the day, how do I say this?
Say it as it is.
The inequities and the disparities are clearly being exposed. Okay, so you don't have to do a whole lot of studies to see it if you're here in the States. If you pay attention to what's being shown on the news, if you pay attention to any particular hospital. I volunteer at 2 children's hospitals, and so they are gathering that data because you go into the healthcare industry to help people. Yeah. And at some point, and I know the 2 that I'm connected with, the one out here, they don't have as many cases. The other one is in New York. And that hospital, that institution, is gathering the data trying to find out what's happening. They're actually looking at the data going back towards the disparities. Now, they're in the middle of all of this, so they can't really address the disparities right now, but they're gathering the data, right? And so it's clear to people.
See,
What we
from
do is a
yeah,
different ballgame.
yeah, it's different because I think over here when you watch the news, the bodies that gets rolled out of these hospitals or nursing homes are often covered.
Yeah,
So really, you actually don't see that the
right.
majority are, as you saying, are African Americans that are being impacted. So it's interesting because I don't know, but obviously, I mean, I don't know how we can actually now go down the path of the whole thing that's happening in the States at the moment. With the death of what's what was it?
George Floyd. George
George, yeah,
Floyd.
that's right, Mr. Floyd,
Yeah.
and a young woman that filmed that. I hear she's kind of got a bit of backlash, but the poor thing said, she, what she's 17. What else could she do? But what's your perspective on that?
So what I'll share with you, there are a couple things, right? And so we had the incident with Ahmaud Arbery in Georgia. There was an incident with Breonna Taylor, I believe that was in Texas. We had an incident in Central Park where a guy was minding his business, and that was after uh, George Floyd.
After,
So yeah, the Central Park was afterwards. I'm pretty sure. And so you've had four different kind of incidents that have shown up, but the protests are about the how um, Mr. Floyd was
pin,
dealt with,
yeah.
right, and killed, and so there's a lot of discussion. Like I have friends that are in law enforcement. I have friends who, um, who are talking about protests, and they've protested, they've been peaceful, and all of that. So when you think about all the people that are out there, most are peaceful.
Mm.
Most are. And so one, that issue of being on someone's neck for what was it, minutes or whatever it was, should have never happened.
Yeah.
Um, he was not being aggressive. He was already handcuffed. Uh, yeah, that shouldn't have happened.
Mm. And so, from your perspective, you've seen, I mean, you hear about it constantly, don't you? How African Americans are being dealt with, and sometimes I feel that it this is just one case. It's not going to happen again, and then another story said this is another isolated case is not going to happen again. Like, so you kind of trying to kind of tell yourself that it's not the norm.
Mm-hmm, mm-hmm, mm-hmm.
But you living there and being an African American, what do you think? How do you feel about it when you hear and see another story like George Floyd?
So,
And as somebody who's so keenly focused on humanity and belonging.
right, right. So let's look at it this way. I was talking to someone else today. It was a faith-based organization, and we were having a conversation, and we touched on a little bit in the conversation. And I said, everything that you see, everything, is directly linked to fear. Is directly linked to the amygdala. Is directly linked to fight, flight, or freeze. And so I'll make it really plain for you. You've met me, right? You've seen me. I'm not a tall person, 5'11", but I fill up some. I can fill up some space, right?
Yes.
And I have been places without even saying a word and know that other people feel threatened by my presence. Right. And that reaction may be based off of some previous behaviors, interactions with some other human being, or some story that they have about someone who looks like me. And so just imagine how that fear shows up. Okay. And so it shows up for that person. It shows up for me because I can see the fear and I'm like, oh, here we go again. Okay. And so and now if you really want to back it up, there's so much that's baked in from we talk about 400 years. 1619 is when slavery, slaves started landing on what people from the First Nation called Turtle Island. Our friends here who've been here for longer than we have call it Turtle Island. But 1619 is when slaves were brought here. And so think about whomever with the belief that Africans were less than them. Yeah. Okay. And if you never have the conversation to repair and understand somebody else and truly see them, there's generations, that's 400 years of seeing somebody as different or less than. Now, I donate and give blood, right? Because I have it's universal. Nobody has said, I'm certain, once they go there and they're laying in the hospital, well, who gave this, right? Because there's so much about our DNA that is exactly the same, but we get caught up on these differences. But what I will say is the incident, when I think about it, I'm not surprised. Do I believe it will be the last time? There's something different in the air this time.
Why?
There have been, I don't know, 4 days of protests, some riots, and organizations are starting to say, we need to have a conversation. That's Fortune 500 organizations, that's nonprofits, that's churches, faith-based organizations. The police departments are saying, we need to talk. And so some of that, whether it's on the law enforcement side, starts at the academy, right?
Yeah.
And so they're trained to do certain things, but you need to do some other work around the human aspect.
This morning I was discussing with my husband about what happened to George Floyd, and we were discussing in terms of the police or the law enforcement. Why do people choose to go into policing? Is it to help? Is it to ensure that law and order is kept? Or there are other motivation, which often is about the power. And what can law enforcement institutions around the world do today to really shift the mindset of those individuals joining the law enforcement sector? So, and I think, is it now the time to have that discussion? Is that it is about what is the best person for the job, to enforce a law in a society in any society, but in a society like in the US, whereby race relation is still till this day, it seems like, still troublesome.
Right. So oh my goodness, there's so much of that. So I have a couple of friends that we speak frequently, okay, and they are in law enforcement. And I remember years ago, I had asked the question. I said, "Hey, he's African American." I said, "Who typically is the best candidate?" Right? Not, and it doesn't matter about race, just their background and experience. He said, "Bart, to be honest with you, the people who turn out to be the best officers are people who were once COs, so correction officers in a prison, because they've been in the prison system, they've met the folks that are there, they understand their background, they understand them, they know how to talk to people. Typically, when they come into the law enforcement part of it, they already know the language. They know how to communicate with people. They understand what it means to de-escalate a situation." they said that sometimes, and this was his perspective, because he trained a lot of people. He was working at an academy. Sometimes there's a little bit more work when someone comes from a military background, because their training is handle the situation, right?
Yeah.
If they're deployed anywhere else in the world, handle the situation. Now they do have some underlying values around people, but at the end of the day, once I'm locked and loaded, I got to do what I got to do. He said typically there's a little bit more work because the mindset is military and not necessarily around de-escalation. So just imagine if I don't know, some community, you've never been in that community before, you go visit and you see some kind of behavior that you're like, I'm not sure if that's aggressive, but it's something different. I don't know. You're again, going back to the amygdala, you have a couple choices. You can run, which is flight. You can fight. You can say, well, whatever's getting ready to happen, I'm getting ready to tense up and get ready to fight. Or you can pause, you can freeze and say, well, you know what, let me see what's happening here. Let me enter this space from a place of curiosity. So let's go back to law enforcement. If I grew up in an area that is different from the area I'm policing, and I see something different, how do I respond to it? Do I go back to flight? Well, I'm not going to do that because I've been trained, and they do have the option to leave. That's part of law enforcement. Do I go into fight? Now, I might do that because I want to serve and protect. That's what the job is, right? So I might go into fight, but how do I handle that, right? Do I handle it because of power, or do I handle it to mitigate harm? And those are two different things. And then the last one is the pause. Can I pause and really assess what's happening here, enter this space, and see the humanity in this situation and in the people that are being involved? And those are some challenging things because power does show up.
But Bart, how you described those three scenarios, that's you having that hat on, who's passionate about inclusion, diversity, and equity access, as well as have that keen interest for humanity and belonging. But for the ordinary citizens who get into to the law enforcement, they're ordinary. I mean, they would not have all of those switches on. And how do you train the law enforcement? I mean, I suppose we're digressing now. We're going to just focusing on law enforcement. But if we go back to what you were saying, is that there is it from your perspective, what's happening now with George Floyd. You're saying is that you feel for the first time that there is a conversation is about to shift the whole race relation in the United States. Is that what you're saying?
Yes, right. So because of the emails or a phone call that I'll get that corporations and then faith-based organizations and then just people I know want to talk, right? Man, I don't even know what's happening here. What's happening? I want to talk about it, right? Now, some folks don't understand the language, and so you may want to consider using like the nonviolent, there's a lot of work around nonviolent communication where you talk about, what you're observing, how that makes you feel. And there are a couple other steps, but the bottom line is you get to request and you appreciate each other's perspective and have real dialogue, right? And then in that dialogue, often you need to be able to handle some real difficult conversations with her. And I like to break them up into three things: the actual subject, that's number one. Number two, the feelings about that subject. And then the third thing is the way my identity shows up around that topic. Right. So let's think about I don't know, something about kids, right? Whether or not you believe in timeouts, putting your kids on timeout, right? So all it is, kid acts up, you're gonna go sit and be in timeout quietly. Okay. For some people, the subject is timeout. How I feel about that thing, I may have grown up in a household that we never did timeouts. You went outside and played, or you did something else to just relax. Now, so I may say, man, that's pretty messed up. I feel that feels like harming the child. Someone else, they grew up, they did that. So it's not a big deal. And then our identities, right? Based on who you are and your background, your family, your culture may not believe in timeouts. Someone else's could. The issue is a timeout, right? The subject, the feeling, and your identity show up. And I think that those are the type of conversations that are about to happen. And we hope that there are enough people in that space to do that well.
I don't know. You said at the beginning that there is going to be a journey, a transition from the COVID-19 discussion to this race relation. Do you want to explain how you're going to connect those two topics together? From disparity to race relation, but I suppose there is something there.
Yeah. So for me, there's so much here. There's a doctor, his name is Zachary Green, and he has a little model that talks about post-pandemic, now that the pandemic is happening, or pre-pandemic, now that the pandemic is happening, in post.
Yep.
And he talks about the pre is, it's not here, I don't believe it, that kind of thing. He uses better words than I do, but it's really not happening. And then when it's happening, there's this chaos that shows up, right? Oh my goodness, what is going on? And in the post, hopefully you get to more innovation. What can we do so that pandemic doesn't happen again?
Solutions.
Okay? Right. And so for me, the way my brain processes that situation and the way disparities are showing up is the same reason why you're having the reaction around the death of George Floyd. Because there are a number of people, and I should have had the stats in front of us, but there are a number of people, if you look at the percentage of people in a particular community or population, and then the percentage of people who are incarcerated, the numbers are staggeringly different.
For African Americans.
Right? Yeah, African Americans, Hispanic, and Latinx, it's drastically different than the larger population. So this thing that's showing up in COVID is not isolated to COVID. It shows up in how communities are policed.
Yep.
Right. There are a number of situations that just show up that you're like, it didn't occur that way in X community, but in B community, it does. Why is that? The whole thing around that you're supposed to wear a mask in public right now, right? Yeah. And so you can't have more than 10 people. Now they're moving that number up to 25 people in a gathering. But the way that is handled in different communities is different, right? Now they're starting to be more mindful about, wait a minute, why did we do that? Man, they weren't really doing anything. And so law enforcement are starting to realize this thing. Now, the question is, how do you get people to change those habits and behaviors about how we react to difference, right? Because most of us, for difference, we go into, I need to protect myself.
Yeah.
Right.
They don't embrace difference. It's very hard to embrace difference.
Right. I mean, so I wish I had the report, but I love Australia too. So I was talking to someone or communicating with someone, and she was talking about something around healthcare. And I guess 2 years ago, there was $30 million that was supposed to go to Aboriginal communities, and they represent 10% of the population. People are up in arms around that, but actually the 30 million never made it.
Yeah.
Right. What ended up going was like 3 million or something like that. But just think about the visceral reaction in people around $30 million, right? Why is that? Why do you have that kind of reaction? It's that difference that's showing up for people. And the difference is othering. We'll treat them that way. And so we're bystanding to what's happening. And this is the thing that I would like to say. What it feels like is people are moving from bystanding to upstanding. Okay. Right? I'm tired of bystanding and watching and acting like it's not happening. Oh, this is really in my face right now. Look at the numbers of COVID. Look at what's happening. Look at the protests. I need to upstand and do something different. That's what it feels like is about to happen here in the States, and I hope that it does.
And are they, I mean, obviously, the deaths and the now, obviously, with George Floyd, the attention is kind of taken away from, I believe Americans were blaming China for COVID-19 as well. Has the anger shifted away from China, now to kind of focus more locally about the whole race relation, do you think?
Wow. So,
Initially it was
so,
blame the Chinese, isn't it? Wasn't that Trump's card? It's blame the Chinese.
so what I would say is, and I'm glad you're sharing that with me from a perspective of somebody who doesn't live in the States. That's what you're hearing from the White House.
Right.
Okay. I believe that the majority of folks don't believe that. Okay. It started, based on what we understand, it started in China, right? And so started restricting flights from China. But our cases started from people traveling from London, right?
Right.
And so it wasn't China. It was people who had maybe been in China or whatever. I don't really know, but they came from London, and whether they were on vacation or whatever was going on, just like Italy. Italy happened to really have significant numbers of cases because of whatever, and I have no idea how it got there, right? So the truth of the matter is,
So in the
it
States,
may
it's about the people arriving or coming from London that's spreading COVID-19 within the States.
those were the initial cases, right?
Yep.
And then we also had some of the cruise ships and all that other kind of stuff that was happening too, that I don't even think people knew to track that at first. And then they realized, wait a minute, and then they had just had them floating around in the sea. But a number of our first cases came from people traveling from London. It wasn't China. So you may hear from the White House
Yeah.
someone talking about China.
Someone, it's
I
Trump.
don't.
It's President Trump. He says, blame the Chinese. So it's not somebody, it's the President of the United States.
Yes, yes, yeah. So I'll use that. I'll use the title. The president is saying that, but I do not believe that the majority of the population are aligned with that thinking.
Right, that's
That's just
interesting.
me.
That's interesting. Because over here, all we hear is the States. So in the day-to-day conversations that you hear from ordinary people, it's the Chinese. Look, even the United States said it's the Chinese. So it's interesting then listening to you in the United States saying, no, that's not what the discussion is. It's about, the initial cases came from London, and then of course it got spread. And I think there's a state in the United States, I can't remember the name of that state, whereby they said they had coronavirus there, and there's nobody traveling in or out apparently as well.
Right.
I can't remember the name of the state.
Now again, when did they start tracking that? Right. So they said nobody's been in or out. They could have been, I don't know where it is, but they could have been in New York, and then from New York, they brought it back home. But so, and let me say this, it depends on what communities you're in, right? So again, I spend enough time in healthcare, and so they're talking about that stuff. They track the data, and they're like, wait a minute, no, we need to find out, they do some analysis of where this person has been. And there is no connection to someone from China, right? It's somebody else, some family member that was on vacation someplace. So the data doesn't support that. Now, the rhetoric there are some people that believe that, right? Because there were some reports or some cases at some point in time where I was on a podcast just as a listener, and it was put on by people, I would say, that come from APAC, but they're Americans, right? And they were talking about, I think they called it, I'm going to get it wrong, anti-Asian racism. And so that was the discussion. And it's not, I don't like the title because it sounds like we're going to talk about how we don't like Asians. Yeah. That's not what it was.
Yes.
But right.
Yeah, I remember that.
The group was talking about their experiences here in the States.
Yeah.
And so there were cases and things where people would be on a subway or people would be in public transportation being treated. Don't stand by me. Don't do this. Right. And all that kind of stuff. We did have some of that.
Yeah,
Now,
same here in this,
I
same here in Australia, whereby, if you look Asian, they will just, especially I mean, I have not experienced that, but there have been stories, reports where young people have been abused as a result of them being Asian looking. And they
right.
say you're Chinese, so you brought the disease here, and so there is that movement here. It's it's about standing up for against anti-racism against Chinese or Asians. So yeah,
Yeah.
there's that movement happening here.
Yeah. And so people did experience that. But I would say far and large, people, if you did your homework, you know that's not the case, right? I get it. The president out of the White House is saying that. That's what you hear abroad. But I would say most people, definitely folks that are in healthcare, don't say that. And I would say, most people who really are following what's really happening don't fall into line with that,
Mm.
or
Because
at
when
least in my. Let me be more specific. My circle of friends and network don't believe that.
Yeah, because I mean, I was just going to ask, your father, you know, passed away as a result of COVID-19. Was there a moment when you kind of said, bloody Chinese, they brought this disease here to our country?
Yeah, no. So, oof, yeah, that I would have had some issues with my own self if I had said that. No, 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 no. So again,
Did it occur? Like, what went through your mind? When your father passed away, like, uh, did you think, well, he could have lived another 10 years if it wasn't for this disease? Uh, or did you think about it's the access to healthcare, or who that person brought? Like, was there a blame? I suppose. Did you look for a blame?
mm, hmm, great question. So I would say I did not. So to answer that, there's layers to that answer.
Oh,
I did not go into blame. And so I'm going to talk about two different things. So one, just the experience of him becoming positive and knowing, or what was relayed to us was the first person who had it was the activities director. And so the activities director is just another person who uh, she's living her life and she's going to work and trying to care for elderly people. Okay. Now, if I wanted to entertain blame, I would want to say, okay, from that first person that tested positive, when did you start to really institute masks? We couldn't visit; they had already locked the facility down, so you couldn't come and see your family member. So they were doing that. But what else did they institute? Right, to prevent the spread, did they do temperature checks? Did they test the staff? Just everybody, because there are some other facilities like that have one or no cases. And there's one that was in the news, and I'll send you the link for you to check out. But Diane Sawyer did a report, and in her report, there's I don't even know what the place was. There was a case where all of the staff said, you know what, we're gonna live here, and so they moved into the facility. They didn't leave. I don't know how long they were there, maybe 30 days or something like that, and they have 0 cases of COVID-19, right? Because they weren't in and out and traveling all over the place. So if I were to, and I don't even like the word blame, if I wanted to find out the contributing factors to my father's death, I would ask those kind of questions. Now, on a broader scale, I might look and say, what did we do as a nation to prevent the spread of this thing?
yeah.
So,
Do you think the United States performed well in handling the whole COVID-19 virus?
I think there was too much conflict between those that were trying to make decisions to do that well, right? So there's an area, whether it's business or anything else, where you want to have innovation, where conflict and tension is good when everybody wants to listen. But for some reason, I believe that conflict and tension was unhealthy, from the decision makers. So even again, if I look at the contributing factors for the nursing facility related to my dad, they couldn't get clear direction from the White House, or from wherever, right? Oh, no, do this. No, do that, right? Or it's going to blow over, and then something else is said, right? And so there are a laundry list of contributing factors that led to that. Do I believe that he would have lived a little bit longer without COVID-19? Absolutely, I do. Absolutely, right? Would it have been 2 years, a year? I don't know, but it wouldn't have been. It wouldn't have not have been May 4th. And so the other part of that, and the reason why I kind of paused, so just being candid, obviously I was struggling with the loss. Okay. And I texted a friend of mine, and he responded with something. He said, actually, we got on the phone first, and then he responded with a text. Between the phone call and the text, he said, "Hey, Bart," yeah, and we're new friends. We kind of met each other recently. Different identities, white male. He's a VP at a large organization. And he said, "I don't know if you consider me a friend, but I consider you." And I said, "Yeah, I do too. And I don't know why I text you, but clearly I consider you a friend." And he shared with me that at some point in time, his father passed and he struggled with it. And a shaman told him, "Don't run from the pain." Right. And so for me, because of that, and me, and there's some other stuff, not running from the pain and the grief, I'm honoring the bond that I have had with my dad and have now. So I'm not in that space of blame and, guilt and who owns that. I'm not there, because I can't fix that. Right. So that was the other part where I said, "Ooh, that's an interesting question." So I've moved to a place where I'm really focused on gratitude between the bond between my father and I.
Well, that's lovely. Maybe that's where I should end it. Oh, it's did you obviously it was isolation time when your father passed away. Were you able to attend the funeral? Like, what did you guys do?
No, so could not. No, one, you couldn't even go to identify his body. You couldn't visit, and no service.
Oh
So
gosh. So you never
yeah.
there was no funeral. You couldn't attend.
No, so basically, the funeral home posted a page with some information, and people could write notes and condolences and all that on the page. So yeah.
Where to from here with the world for you? What do you think? How do you think what's going to come out of COVID-19 for the world, and obviously with the situation with George Floyd as well? Obviously, Americans are facing a real interesting, challenging moment in its history.
Yeah, so I would say this. You've heard me say a couple times that I'm either getting a text from someone, a phone call, or an email. And some of these organizations are large institutions where a VP is saying, "You know what, we want to talk about how these cases are affecting our employees." People want to talk. And so I think there's going to be a moment in time to shift it. Right. So imagine. So when I was down there, I think, I don't know if it was right around the same time. Imagine so tell you, I'm going to answer your question. I'm going to finish answering. Tell me what Sorry Day, or tell everybody, folks, that my colleagues that may be here in the States, what is Sorry Day in Australia?
Sorry Day is the day that Australians are kind of asked to pause to obviously acknowledge the loss of lives, or not loss of life, but to the Indigenous community in Australia is Sorry Day. We say sorry to them about what happened.
Right, right. So imagine if you got to the point. Well, I don't want to, I'm making some assumptions, but imagine you got to the point where Aboriginal people really felt that, right? That not just with the words, but the day-to-day actions, they felt it, right? And you had a moment, you had a window, like, man, we're getting ready to do this. I can feel it. We can go in there and have a great conversation. We're going to appreciate each other's humanity. And tomorrow is going to be different. We're going to start on a path of real difference. It feels like we're going to have a window and an opportunity, whether it's Sorry Day in Australia, whether it's Truth and Reconciliation in South Africa, whatever that is, that moment is coming here.
Ooh.
But the thing is, are people really ready for that? Because in some ways, it means owning up to the truth.
Yeah.
And that truth could be, I didn't necessarily do it, but my grandfather, my grandparents, somebody in my lineage did this thing. And that's a truth that for some of us is hard to admit to and own. It shows up in our simple relationships, between husband and wife or partners. For someone to say, I'm sorry about something I did, they struggle with that. Let alone talk about slavery and how somebody may treat somebody differently or see them differently. You're asking, I expect people to do it, but for some people that's a difficult thing to do. But I think we have a window.
I've just been given the date, the 26th of May since 1998. There's been a National Sorry Day, or the National Day of Healing. It's an annual event that has been held in Australia since 1986. 1998. What's your words of wisdom to our audience in terms of advice you can give them, how they can, what did you say before? Standing up? Upstanding?
Upstander.
So upstanders, how to be upstanders. Like, what are some of the words of wisdom you can impart on us to be upstanders?
Yeah. So I would say this. It actually starts with yourself. So I'd asked, I was on and I'm gonna borrow some stuff and I'll kind of wrap it back around. I was on a webinar with someone from the First Nation, Lakota tribe, an elder. And I had asked a question about, this was during the pandemic. So people are experiencing the pandemic, and some people are now home by themselves and struggling with this thing. Because now I'm home, I'm with myself, I'm present with myself. I don't like all this stuff. I said, how do you think people should handle that? And what he said was, he says, let me tell you the story about Iki Tome. And I said, okay. And it's real short, real quick. He says he was somebody who was kind of mischievous. And, one day he's walking and he goes to this pond, and he's, how a pond is nice and clear. It's nice, like almost like a mirror.
With ducks,
he looks at the pond.
With ducks floating around.
Right? It's nice and clear like glass. It's just smooth. And he looks in the mirror and looks in the pond. He sees his reflection. He's like, I like the way I look. And he leaves. Comes back another day, and it's windy out. So the water is kind of wavy and moving all around. And he looks at it and he's like, oh man, I really can't make that out. And he walks away kind of little bothered and upset. Comes back another day and it's raining. Like water is splashing all over the place. It's raining. He looks in there. He can't make out his image. Picks up a rock and throws the rock in the water. And the guy tells the story. He says on the side, there's this fox sitting on the side. And the fox is laughing at him. He said, what are you laughing at? He said, I'm laughing at you. He says, you're upset. And the only thing that's really changing is exterior to who you are. So I say all of that to say this. The upstander, I hope that they are aware of the different circumstances that are changing around them, and don't isolate and start to lose their own identity, but own your story, your truth, your identity, but have enough compassion for some other human being. And compassion is packaged into 4 different things, right? Recognizing somebody's perspective, suspending your judgment, communicate your recognition of that thing, and just really being present with that person. And we think that that's easy, but it's not. Because the second one, suspending your judgment, is difficult. But
absolutely. We judge constantly.
Right? But we're going to have an opportunity to do that. But people, to upstand, you got to do your own work and know who you are, acknowledge who you are, cut yourself some slack, and be willing to step into that uncomfortable and difficult space. So I would say to be an upstander, really do your own work and be willing to step in difficult and uncomfortable spaces.
So the difference is you.
Yeah. Yeah.
Thank you so much for those words of wisdoms and really an inspirational conversation with you today, Bart. I really appreciate that.
Thank you.
Thank you, Dawncast. That was Bart Bailey joining me from Pennsylvania in the United States and sharing with us the COVID-19 and the race relation that's happening in the United States at the moment. Thank you for watching Dawncast. And if you like more content like this, please make sure that you subscribe, click on the bell at the end of this broadcast and press like and share comments. And if you've got a story that you want to share with us, send us some comments and send us some suggestions, and we'll would like to share the stories to our audience. So thank you. See you. Bye.
Thank you. Take care.
Take care. Thanks. Bye.